Hi, my name is Angel, and I've chosen forensic psychology as my sales pitch topic. For starters, what does it take to be a forensic psychologist? In order to work as an actual forensic psychologist, you need a bachelor's degree, a doctoral degree, or a PsyD in an accredited university. After you finish these, you need 2 years experience postdoctorate. However, there are several states that will allow you to practice forensic psychology under a doctoral level psychologist. Forensic psychology is considered one of the fastest growing careers in the psychology field. There is a constant need for evaluations, someone to give expert testimonies, and contribute to programs for correctional facilities. The Bureau of Labor Statistics, BLS, projects a 7% growth in employment for psychologists overall from 2023 to 2033. One of the more popular careers in forensic psychology is working with the FBI as the behavioral unit. As a child, I looked up to my cousin, and as he studied forensic psychology and eventually secured a job as an FBI analyst. Some skills that you would need for this would be analytical and critical thinking skills, excellent communication skills, problem-solving skills, ethical conduct, high standards. In order to pursue this career, one can have just a bachelor's degree along with 2 years work experience in a related field. If a graduate degree is earned, then only 1 year of work in a related field is needed. While it can be highly stressful, there are many pros to account for in forensic psychology, like intellectual stimulation, and analyzing complex cases, making a difference, contributing to the legal system, helping victims, rehabilitating offenders, potential for high earning and competitive salary, especially with experience and advanced degrees. There's also diverse career paths. There would be the licensed professional clinical counselor, in that you would provide therapy in correctional facilities. You could be a correctional counselor, work with incarcerated individuals, and promote rehabilitation. Jail supervisor, overseeing and management. Victims advocate, supporting victims and their families. Jury consultant, that would be helping the attorneys understand jury behavior and strategy. Federal government employee working for the FBI or Department of Justice. Probation officer supervising individuals on probation. And police consultant, that would be advising law enforcement about criminal behaviors and psychological issues, which may help to de-escalate problems before they get too far. So, if you chose to work in this field, you need to be able to separate yourself from the situation at hand. When I was working as a technician at a forensic psychiatric hospital, I learned just how horrible the staff could be. I witnessed them openly making fun of and physically abusing patients. One of them was a registered nurse, and he was kicking a patient on the ground where he fell. When I tried to advocate for him, the staff just told me, after what these people have done, they're not human anymore. Some employees start with a positive and compassionate attitude, but give in when met with opposition by many of the abusive staff. I had a nurse tell me once not to even fight it because it's not going to help anything in the end, so just kind of go along with it. I understand we all have our own opinions, and some of the behaviors displayed are hard to witness, but we have to leave our judgments at the door. Working in this field means sometimes we have to show compassion even when we don't want to. So, my question: why do you think that some professionals in this field become abusive to the patients? And as a follow-up, what is something that they could do to stop this before it even starts?